Welcome to Politics and More. I'm Jeff Rowan. Today I'm going to be talking about health care, in particular the extraordinary cost of health care. I'm going to be talking about an article that I read recently called Bitter Pill: Why Our Medical Bills Are Killing Us. During the run-up to the passage of the Affordable Care Act, otherwise known as Obamacare, there was a lot of discussion of the spiraling costs of health care. The catchphrase of the day was bending the cost curve, that is, limiting the growth of the dramatic increases in healthcare costs that we've experienced. But most of the focus of that time wasn't on the cost of healthcare. It was about who was going to pay for those costs. So, for example, were we going to rein in and regulate the insurance companies better? Were we going to have a public option that would distribute the costs in a certain way? Were we going to have exchanges that people could buy into? How were we going to pay for these great costs of healthcare that consume upwards of 20% of our GDP? Well, writer, lawyer, author, and founder of Court TV some years ago, Steve Brill, decided that he would attack this issue from a different angle. He decided to go back to first principles and ask the question, why are our healthcare bills so enormous to begin with? Why is healthcare increasing in such a manner? What he decided to do was incredibly simple, but incredibly profound. He decided he would take a look at the actual healthcare bills, the hospital bills, of 7 individuals, go through them line by line, decipher all the medical code, and figure out what are hospitals charging and why are they charging it. So, what I'd like to do is present some of his findings, which are, frankly, quite shocking. The first patient he looked at was a guy named Sean Ritchie, a 42-year-old guy from Ohio, who had recently been diagnosed with lymphoma. He had an aggressive form of cancer. He decided to go to one of the well-respected hospitals in Texas, the MD Anderson Center, to be treated for this lymphoma. Now, the first problem he ran into was that he had very limited insurance. He and his wife were self-employed. They had bought some relatively minimal insurance that reimbursed for very little of his intended hospital care. So MD Anderson, the hospital in question, told him that they would need a payment in advance of $48,000. It's a lot of money. Because of the gravity of the situation, they had no choice. Sean's wife went to her mother. Her mother was generous enough to write a check, and that entitled him to a 6-day diagnostic stay at the hospital where they would examine him thoroughly, give him a battery of tests, come up with a treatment plan, and let him know what his chemotherapy regimen should be. So once through that diagnostic period, the hospital demanded another $35,000 before he could actually start the chemotherapy, because it was a very expensive, very promising, very good, very cutting-edge drug that they prescribed him, but very expensive nonetheless. So that required $35,000 more. So in order to gain treatment from this hospital, it required an advance payment in toto of $83,000. It's a lot of money. Now, I'm not going to question with any of the patients that I talk about today the quality of their care. I'm assuming the quality of care was excellent. The question at hand is, what were they actually paying for that quality of care? So let's look at Sean's bill once Steve Brill began to analyze the bill. The first line of the bill was somewhat trivial, but it wasn't very promising in terms of maintaining a tight cost structure. The first line was acetaminophen, 1 pill of generic Tylenol. Now, generic Tylenol you can buy it at CVS or Amazon.com, and it would cost you about 2 cents a pill for generic Tylenol. What was the charge on the bill? $1.50. Now, $1.50 doesn't sound like a lot of money because the absolute amount is rather trivial. But that's a 75-time markup from the actual price of the Tylenol if he had simply brought in a bottle with him during his stay. So that's not very promising. He read down the list a little bit and came upon something that said chest, PA, lat, 71020. That's medical code for a standard chest x-ray. So what did the hospital charge for a standard chest x-ray? $238. Now the question then is, what would Medicare pay for the same chest x-ray? The answer is $20.44. So you've got $238, you've got $20. And this is going to be something that's thematic in Steve Brill's findings and thematic in what I'm going to be talking about today, which is that compared to Medicare, if a private individual with no or minimal insurance goes into a hospital, they're going to be paying more than Medicare by a factor of 10 or even 20 in the pricing scheme of hospitals. So those are two grossly inflated prices right there. The next charge on the bill that caught Steve Brill's eye was something called alcohol prep pad. Now, an alcohol prep pad, we've all experienced it. An alcohol prep pad is what the nurse uses when she's about to give you a shot. And she takes the little cotton ball or pad and swabs you with alcohol to clean the area. If you bought a box of alcohol prep pads on Amazon, it would cost you a penny a pad. What did the hospital charge? $7. For each alcohol prep pad, they charge $7. So we're talking about essentially a 700-time markup on cotton balls. Cotton balls that essentially cost a penny a piece are charged $7 each. Now, I think you can see where I'm going with all this. On every charge, big and small, the markup of the hospital is fabulous. It's enormous and is obviously very hard to justify.